Now, let's reflect that physiotherapists are the latest to walk out with industrial action, and they're joining ongoing strike action, of course, over pay and conditions, we should say, in the health sector, also involving support staff as well. Well, joining us now, Claire Sullivan, Director of Employment Relations at the Chartered Society of Physiotherapy. I was indicating, Claire, that it's not just about the pay packets. The sort of stories coming out of people crying on the job, the frustration that they're feeling across the board, it seems.
I mean, you're absolutely right. It isn't just about pay. I think pay is a critical issue at the moment because of the cost of living crisis and because of the pressure on public sector pay over the last decade. But of course, the real issue here is that the current pay levels and the working conditions, particularly with all the additional pressure during Covid and the efforts to rehabilitate and catch up on all the work that was required during Covid, all of that means that we are losing staff. People are retiring early, people who are leaving to work outside the NHS, and people who are just leaving, as you said, because of the sheer physical and mental exhaustion, which means that the physios who are left simply can't provide the services that patients so badly need to solve all the problems we hear about every day with hospital beds, with social care, and frankly, with people's quality of long-term life.
Yeah, and I suppose, people could actually pick up quite a lucrative career as a sports therapist, for instance, in the private sector. But just explain to us how important this part of medical work is, particularly, I guess, on older people who may have been bedbound for a while, for instance.
Yeah, I mean, you do tend to hear, don't you, about physios doing the critical work in sport and with musculoskeletal injuries. But actually, physios are there beside you, whatever your health needs, all your life. So from working in neonatal intensive care with premature babies to working with older people at the ends of their lives, enabling them to stay in their own homes and to be as fit, mobile and independent as possible for what are longer lives these days, and in every point in between.
And we hear about the sort of joined-up action going on with the nurses, the ambulance, even junior doctors, of course, have issued warnings. I mean, I think February the 6th is probably going to be the big day. I mean, would the physiotherapists once more join that particular sort of coordinated action?
I mean, our next two strikes are in Wales on February the 7th and England again in a further 33 trusts on the 9th of February. And I think all of us in the NHS, apart from doctors, are on the same pay, the same hours, the same working conditions and the same benefits. So we are working together, but we don't necessarily all need to be doing it on the same day. And I think we have different roles, we have different pressures, but actually the pay claim that we've made, which is for an above inflation pay rise, and the improvements to the things that are going to help us keep and retain staff are ones shared by all of us. I think the widespread number of people involved tells us just how acute the problem is.
Indeed. I mean, Steve Barclay indicating a double-digit 10%, that's not going to happen. I mean, would your members, for instance, accept a lower figure if they got an indication that the working environment would be made better?
I mean, I think the problem at the moment, we're in a vicious circle because until we do something about pay, the working environment is not going to improve because there are just not enough people staying. There's too much of the NHS's money going into agency staff because we're short-staffed, into recruiting and inducting and training new people as people leave. And we've got to get ahead of this problem. And pay is the short-term requirement to do that. Once we've done that, and to be absolutely honest, you'll have heard this before, we have been asking the government to talk about pay since last summer. We are open to all and any offers. We want to be in formal negotiations. We know that between us in the health unions and the employers across the health service, we can do a deal and make this work. There is absolutely no question about that. But at the moment, the government is blocking those talks.
Claire, thank you very much indeed for time and joining us on GB News. Thank you.
Thank you very much.